When you start taking Xarelto, make sure to read the medication guide provided by your pharmacist. Take this medication by mouth as directed by your doctor. For preventing strokes and blood clots due to an irregular heartbeat, take a dose once a day with the evening meal. For other conditions, such as after surgery or during a hospital stay, also take a dose once a day. For adults treating blood clots, take a dose twice a day for the first 3 weeks, then once a day. For children, the dose is usually once a day. If you are taking this medication to lower the risk of blood clots from forming again, the dose is usually taken once a day. Carefully follow your doctor's directions and do not change the dosage without consulting your doctor. The 10 milligrams tablet may be taken with or without food, while the 15 milligrams and 20 milligrams tablet should be taken with food. If you have any questions about how to take Xarelto, ask your doctor or pharmacist. If you are unable to swallow whole tablets, you can crush the tablet and mix it with applesauce, but do not prepare a supply for future use. If you are giving this medication through a tube into the stomach, ask your healthcare professional for detailed instructions on how to properly mix and give it. The dosage and length of treatment is based on your medical condition and response to treatment. For children, the dosage is also based on weight. Take Xarelto regularly at the same times each day to get the most benefit from it. If you experience easy bruising or minor bleeding, such as nosebleeds or bleeding from cuts, make sure to tell your doctor or pharmacist right away. Remember, this medication has been prescribed to you because the benefit is greater than the risk of side effects for you. However, this medication can cause serious bleeding if it affects your blood clotting proteins too much. Make sure to seek medical attention if you notice any signs of serious bleeding, such as nosebleeds that happen often or don't stop, unusual tiredness or weakness, prolonged bleeding from cuts or gums, or difficulty swallowing. In very rare cases, a serious allergic reaction may occur, so seek medical help if you notice symptoms such as rash, swelling, severe dizziness, or trouble breathing. If you notice any other effects, make sure to contact your doctor or pharmacist for advice. Always consult your doctor before making any changes to your medication. Before starting Xarelto, make sure to inform your doctor or pharmacist if you have any allergies. This medication may contain inactive ingredients that can cause allergic reactions or other issues. It's important to discuss your medical history with your doctor before using Xarelto, especially if you have a history of cancer, liver disease, kidney disease, bleeding problems, stroke, blood disorders, or certain clotting disorders. If you are planning to have surgery or any medical/dental procedures, let your doctor or dentist know that you are taking Xarelto, as they may advise you to stop taking the medication before the procedure. It's important to note that using alcohol while taking Xarelto can increase the risk of stomach bleeding, so it's best to limit alcoholic beverages while on this medication. Xarelto can also increase the risk of heavy bleeding, so it's important to use caution with sharp objects and to avoid activities that may lead to injury. If you do experience a fall or injury, especially to the head, it's important to contact your doctor right away. It's important to note that older adults may be more sensitive to the side effects of Xarelto, especially bleeding. If you are pregnant or breastfeeding, it's crucial to discuss the risks and benefits of using Xarelto with your doctor before continuing with the medication. It's important to be aware of potential drug interactions when taking Xarelto. Certain medications may change how Xarelto works or increase the risk of serious side effects. Always keep a list of all the products you use and share it with your doctor and pharmacist. Don't start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Xarelto include mifepristone, other drugs that can cause bleeding/bruising, certain antidepressants, and other medications that can affect the removal of rivaroxaban from your body. It's also important to note that aspirin can increase the risk of bleeding when used with Xarelto. However, if your doctor has directed you to take low-dose aspirin for heart attack or stroke prevention, you should continue taking it unless your doctor instructs you otherwise. Always consult your doctor or pharmacist for more details on how to take Xarelto safely. If you or someone else has taken too much Xarelto and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek emergency medical attention immediately. In the U.S., you can call 911 or contact your local poison control center at 1-800-222-1222. Canadian residents should call their provincial poison control center. Symptoms of an overdose may include bloody or black stools, pink or dark urine, and unusual or prolonged bleeding. It's important to remember not to share Xarelto with others and to keep all medical and lab appointments, as your doctor may want to perform tests to monitor your condition. This medication is used to prevent blood clots and is usually taken once a day with or without food. Your doctor will determine the best time for you to take it based on your individual needs. Remember to follow your doctor's instructions carefully and not to adjust your dosage without consulting them first. If you miss a dose of Xarelto, take it as soon as you remember. If it's close to the time for your next dose, skip the missed one. Don't take a double dose to make up for the missed one. If you are taking Xarelto twice a day and miss a dose, take it as soon as you remember. If you missed the morning dose and it's near the time for the evening dose, you may take both doses together and then take your next dose at the regular time. Keep Xarelto at room temperature, away from light and moisture. Avoid storing it in the bathroom and make sure to keep it out of reach of children and pets. If you crush the tablet to mix with food, be sure to use it within 4 hours. Make sure not to flush Xarelto down the toilet or pour it into a drain unless specifically instructed. When it's expired or no longer needed, be sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.